Judges Appointments and Equity Committee is now called to order. Madam Clerk, would you please call the roll?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Turner.
Present.
Mr. Gallagher.
Here.
Mr. Miller.
Present.
Ms. Conwell.
Present.
Mr. Sweeney.
Present.
You have a quorum.
Thank you. Is there any public comment?
No, Madam Chair, no one has signed in.
Okay, thank you. I'll make a motion to approve the minutes from the April 16th meeting. Can I have a second?
Second.
It's been moved and seconded. All in favor?
Aye.
Okay, thank you. Oh, any opposed? No.
Resolution 2024-0149, confirming the county executive's appointment of Dr. Molly Wimbiscus to serve on the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County for the term July 1st, 2023 through June 30th, 2027.
Good morning, Madam Chair. On behalf of the county executive and pursuant to section 340.02 of the Ohio Revised Code, I'm here to recommend the appointment of Dr. Molly Wimbiscus to the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County for the term July 1st, 2023 through June 30th, 2027. Dr. Wimbiscus will be replacing Daniel Kelly's seat, and she's joining us via Zoom this morning. Thank you.
Okay. What were those terms again?
So this term started on July 1st, 2023, and will end June 30th, 2027.
All
My
right.
notes.
Good morning, doctor.
Good morning. Thank you for having me.
How are you?
Doing well, thanks.
All right. Do you have an introduction?
Well, sure. First of all, thank you for this invitation. I'm a child and adolescent psychiatrist. I work at Cleveland Clinic. I'm the training director for Child and Adolescent Psychiatry Fellowship. So that means I assist with training future child and adolescent psychiatrists.
Thank you.
I also am the director of our school mental health program, which incorporates collaborative work across healthcare and educational settings to improve outcomes for kids and families, and also to support our workforce and each other. I have been working at Cleveland Clinic since 2006. I started my residency, and I've been staff since 2011. I also work at Neighborhood Family Practice, and I take 2 of our fellows with me there, and we work with the team in collaborative care, and I've been doing that for about 6 years. I'm looking forward to serving on the board and supporting our county and supporting our youth and families with mental health supports and general health supports. One of my interests is collaborative care. So I'd be glad to go over the details of that if people are not familiar with it. A few other areas of interest are workforce development and interinstitutional and interdisciplinary work. That is important in this field and in mental health because there are so many different partners who come to the table to support youth and families with our general health, and also thinking about preventive strategies and sort of proactive care. So those are some of my areas of interest. I'm glad to answer any questions that people have. I'm glad to talk more about a couple other areas of experience if that's interesting to anyone.
Absolutely. Can you go ahead and talk to us about collaborative care?
Sure. Collaborative care within the healthcare world means that we are working across our different disciplines. So for example, I'm a specialist in mental health. I collaborate with primary care partners or other people who are considered health allies, healthcare allies, who are working within the field. And so we come up with strategies to better expand the workforce and increase access to mental health care, and also think about strategies to help with preventive interventions to support youth and families who may be struggling with a mental health disruption or a crisis at the time. That might mean that if a child is being seen by a primary care partner, so a pediatrician or a family practice doctor, we are coordinating care, and although we may or may not directly see the child, we're supporting our partners who are working closely within the medical home to support a child and family. Oftentimes we will see the child and family, and then we'll share care. So a follow-up visit may be with primary care, to check in and see how things are going. And then the next visit may be with a specialist in mental health. And so that way we increase access to care, and we also build training in vivo, a kind of across our specialties.
Okay. And you mentioned you had an interest in workforce development. Can you talk to us about that?
Sure. So one of my passions is training future doctors. And also I like, I work with allied health professionals. So mid-level providers, nurse practitioners, physician assistants will also train with doctors to develop skills in specialty care. We also collaborate across our institutions with social work colleagues, clinical counseling colleagues. And then interestingly, I enjoy, some of the work I enjoy the most is working with people who are serving in schools. So educational colleagues who also provide support for kids and families who are experiencing mental health disruption or having a mental health crisis. So we're collaborating together to better serve the youth and the families that we work with.
Okay, thank you. The ADAM board normally meets every month. Do you anticipate having any difficulties making it to regularly scheduled meetings?
I should be able to meet every month. I was aware of that.
Okay, good. And my final question, do you believe certain segments of the county's population could be better served by the Adams Board? And if yes, where are those segments, where are those opportunities? And how would you improve or recommend improving services?
That's a good question. I think there are a lot of people who are marginalized or don't have access to care. One of the most important strategies, again, is through collaboration with organizations that are established within different communities. One of the pieces of work that is very near and dear to my heart is expanding our comprehensive school mental health program. So just to give you background, we are serving youth who are within schools who may not have access to mental health care. And we are moving to a new district next year. And over the next 4 years, we'll be in subsequent districts. It's very important that we recognize and provide services within communities of minority youth, so youth of color, families and children who have not experienced, who have had social and emotional disturbances or economic disparity. And a lot of our programs are serving those regions, and that's part of our priority districts.
Okay, thank you. I open it up to my colleagues, the chair of the Health, Human Services, and Aging Committee.
Thank you, Madam Chair. And to Dr. Wimbiscus, I see something on your resume, currently serves on following boards, youth risk behavior. Can you speak a little bit about, I've never heard of that.
So the Youth Risk Behavior Survey is a national survey that's administered to high school and middle school youth. It's administered through the county. So the Youth Risk Behavior Survey of Cuyahoga County is managed through Case Western University. This survey is very, very important. So I think that it's critical that we do understand the data that's collected over time. This survey allows us to identify trends in behaviors of youth, so risky behaviors, mental health outcomes, and to look and see how youth, these trends are affecting kids over time. So, we have a lot of data collection, and I think one of our questions is often, what do we do with our data? How do we apply that so we can better serve families and youth? This survey allows clinical teams and communities to better understand the specific needs of those specific communities. Yes, it's critical to be able to have that data over time. So that is funded through different sources, including the county.
And does public have access to the survey?
Yes, and I can share that website with you. There's actually some really good links and like flyers that families, community members, youth serving organizations, schools can look at to identify what are some of the trends. And it's not always negative. We've had some positive trends too. So what are some of the trends that are occurring for our youth over time? And how do we best use that data to help us support our specific communities? It's divided by regions. And some data, the granular data can't be directly shared. It's released to the districts because people want to be able to kind of assess and analyze their own individual data, but the larger data, the de-identified data by region is able to be seen.
Following, final question, what is the age group for the youth that the survey covers?
That's middle school and high school. And I'm an advisory member on the board. There's wonderful people who are leading the work and who are experts. And I've been doing that for several years.
If you could send those links to the clerk, I'd appreciate it.
Sure.
Thank you, Madam Chair.
Okay, thank you. Councilman Miller and then Sweeney.
Madam Chair, Dr. Wimbiscus, thank you very much for your willingness to serve. And in the last week or so, I read a very disturbing report that said that a high percentage of the cocaine and heroin that's sold, something like half, is laced with fentanyl, and even for marijuana, it's very substantial. And my question is, what do you think the implications are of that, for what our prevention strategies should be on reducing opiate fatalities?
Yeah, it's a hard question, and it's affecting our entire community. And you see it in the youth, and you see it in the youth who've lost their family members and their parents. I think prevention is important, but harm reduction has been a strategy that has been helpful. So having access to Narcan and having access to treatments available in the community and having people trained seems to be a harm reduction strategy that is not perfect, but it seems to help. Education, of course, is really critical, but exposures and substance use and the addiction cycle is a very, very difficult process to treat individually, and it has to be a larger community endeavor. When you see it individually and when you are working with youth in schools, some of the strategies like group programs, we work a lot with community mental health resources or recovery resources in schools and have some group prevention programs. They can be helpful. At this point, I think the exposures are so pervasive that the response has to be significantly across multiple institutions and organizations. And I don't know that there's a single answer for the complexity of our substance use problems, particularly with the fatal dosages of the opiates right now.
Okay, thank you.
Hello, Madam Chair. Hello, Ms. Wimbiscus. Are you part of the Wimbiscus family from St. Mel's?
I am, Mr. Sweeney, yes. Well, I will say I married into the family, and so some people say I upgraded, I guess.
I don't know about all that. I went to school with Bobby, so you know. Oh, it's really nice seeing you. You brought some good memories back. Which family practice do you work at? Because there are two in my district.
Neighborhood, so I'm at Cleveland Clinic. I'm in Lutheran right now. I live in Cleveland and I walk to work, I will say that. So I'm at Lutheran Hospital for Cleveland Clinic. Neighborhood Family Practice, I work on the Ridge Road office.
Okay.
By the Days Mercado.
Yeah, I have the privilege of the one on Puritas and the one coming down on Lorraine Avenue.
I work closely with the teams, the behavioral health teams and primary care doctors within those practices.
Just with the Adams Board, they've been doing great work for a very, very long time. And once in a while, this is more of an awareness thing. Once in a while, they get drawn into some politics when the budget time comes. And with the board itself, the strong independent woman that you are, to be able to help work with the executive director to give the guidance that's necessary. That's just more of a, have you thought about that at all? Just in regards to what role you play as a board member in regards to the direction of the operation.
So I've done some reading and a little bit of research and have some, obviously I follow the Adams Board for many years. Can you give more specifics on how you might advise, or some thoughts you have for me to?
Sometimes it's a executive director driven and the board helps it along. And sometimes it's a board driven, given the direction to the executive director. Because most of the folks on there bring a very unique perspective, and altogether, I think it's something that is powerful to be able to utilize. Does that make some sense?
Mm-hmm. So being thoughtful about the different influences of which body is making decisions, and thinking carefully about governance versus getting in the weeds or operational directions needs to be present on all of our minds.
My last question, is the artwork behind you for sale?
Oh, I'm sure my patients would love it. I'll just say, when we did a project years ago in 2010, 11, but the kids who'd been hospitalized, they created art. They went around the city and they took a lot of photos, and then they sold it at a gallery. And one of my patients made a substantial amount of money from her wonderful photography. So I can ask.
The one behind you with the little girl with the bow on, seems like with the pumpkin theme. Sorry for deviating, Madam Chairwoman, but I just wanted to share that. And welcome aboard.
All right, thank you, Mr. Sweeney.
I have a question. I hope it's not weird, but you talked about your interest in the youth and in the schools, and I'm in schools quite a bit, and I've noticed a lot of behavior challenges, especially around focus and getting kids to pay attention. And I was talking with an educator just a couple of weeks ago. I've been researching this. It seems like we have maybe the grandchildren of those who were affected by the crack epidemic. And I was wondering if there's any research, or have we done anything targeted to try to address some of the educational needs, mental health needs, and concerns of these children, and why they are having such a difficult time succeeding in the school settings.
Wow, that's a great question. So I mean, you're talking about like generational impact and exposures and stress that is carried within us. And then looking at education, the complexities of education now, and there's so many pressures within the schools of meeting kids' needs, but also helping kids stay on task and learn what they're supposed to learn, and how that's determined. So like many different variables there. There is a lot of research. I can't maybe cite the comprehensive picture, but what we do recognize is that toxic stress or adverse life experiences or adverse childhood experiences have tremendous impact on the developing brain. But that's not a sentence, that's something to know. Because if we know that, then we can think about strategies to better improve outcomes for kids and families. And again, we want to be careful not to think about what's determinant versus what is an influencer, and using influencers to help us think about interventions and strategies. I will say some of the very interesting work is thinking about supporting youth who are identified as struggling, right? So you kind of have a screening process and you triage and you make sure that we are trauma informed or compassion informed as we're working with youth and families, especially if there have been levels of toxic stress in their family. And then thinking about strategies to support the unit that helps a child. So sometimes just working with the child can be helpful and we can start to see some resilience and some investment in what adults are saying is important. But oftentimes when we build relationships and support families, there are better outcomes for the child and for the family. So oftentimes we meet a child, but there's 3 other siblings within the district, and we can have build stronger relationships, again, with humility to support a family, and understand from a cultural perspective as humbly as possible what strategies make the most sense. I think schools often know. I know I have tremendous respect for educational colleagues, and I think schools often know some of the strategies that would be most helpful, but we may not always be talking across our organizations and across our systems to implement some of those strategies. I don't know if that answers your question, but there's a lot of risk that comes from the generational stress and the toxic stress that kids experience. We haven't even talked about exposures to screens and sleep problems. So that's also occurring, and that's very contemporary.
Absolutely. Well, I'm comforted to know that it is on somebody's radar and know we are still in the midst of another epidemic with opioids and fentanyl, and we'll be having this conversation in 20 years about the effects that it's had on children as well, and their ability to learn. So are there any other questions for Dr. Wimbiscus? I'm so glad that we finally got a chance to meet you. The legend of Molly Wimbiscus.
I'm sorry it
It's
took
like,
so
is she
long.
real?
It was fun. Those were fun emails, but thank you so much for, inviting me. And I really look forward to serving, and I will take feedback and guidance on how to do this best.
Absolutely. Thank you for your willingness to serve. Okay, we'll go ahead and,
Like me to make a motion?
a motion has been made.
Second.
It's been moved and seconded. All in favor?
Hi.
Could you add my name just for old time's sake?
Please add Councilman Sweeney's name.
Madam
And-
Chair, to confirm that's on second reading suspension.
I'll make a motion to move this to the full council on second reading suspension.
Oh, is there a second?
Second.
It's been moved and seconded. All in favor?
Hi.
Thank you.
Enjoy the rest of your day. Thank you, Doctor.
The next item will be taken out of order, item 5H, Resolution 2024-0159, confirming the county executive's reappointment of Carla Ruiz to serve on the Cuyahoga Regional HIV Prevention and Care Planning Council for the term April 1st, 2023 through March 31st, 2026.
Madam Chair, on behalf of the county executive and pursuant to section 6.04 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Carla Ruiz to serve on the Cuyahoga Regional HIV Health Services Prevention and Care Planning Council to a 3-year term that started on September 28th, 2023, and will end, October 28th, 2023, and will end October 27th, 2026. I would also like to call up Monica Baker, who is the grant supervisor for the Ryan White Part A program at the Cuyahoga County Board of Health, to talk a little bit about this specific board, just to give you guys an overview before you hear from the rest of our nominees this morning. Thank you.
Excuse me,
Thank
Ms.
you.
Toscas, can you confirm the term that's listed on the agenda versus what you just stated?
Yes. My notes may be wrong.
We have April 1st.
Yes. My apologies. It is April 1st, 2023, and will end March 31st, 2026.
Thank you.
My apologies.
Okay, great. No worries. All right, good morning, Ms. Baker. Please state your name for the record.
Good morning. My name is Monica Baker, and I am the grant supervisor for the Ryan White Part A program in Cuyahoga County.
All right, so give us a summary.
Sure. So Ryan White is a federally funded program that provides funding for services to people who are currently living with HIV and AIDS. We receive, when I say we, I mean the Cuyahoga County Board of Health, as the recipient of the grant for those services. As a condition of that grant, we are responsible for pulling together the community who are most affected by HIV and AIDS and having a planning council that provides and informs on the specifics regarding the services that we do provide. So our planning council provides guidance on prioritizing the needs and the services that we provide, as well as resource allocation. And so it is very vital that we have these voices that we work with on a regular basis to make sure that the funding that we do receive is provided to the community in a most relevant way. We do provide these services to over 3,000 persons a year throughout our jurisdiction. And so it's just a very important part of our administration of the grant, making sure that the voices of the persons who are most influenced and affected by HIV and AIDS are heard, and they do help us steer the direction of the services that we provide.
Any questions for Ms. Baker? Okay, well, thank you so much for that.
Sure, thank you.
Thank you, Monica. I think Carla is joining us remotely this morning.
Good morning.
Good morning.
Please state your name for the record.
My name is Carla Ruiz.
And tell us a little bit about yourself and why you have an interest in serving on this council.
Sure thing. So I am currently the HIV Client Services Manager for the state of Ohio, which oversees the Ryan White Part B program, specifically groups and organizations that work with individuals living with HIV. A little bit about myself is I came to Ohio originally as my first job was actually to run the safe house for individuals who are survivors of human trafficking. From there, I worked with individuals who were medically diagnosed with an IDD, so intellectual delay or disability, and worked in behavioral health. And from there, I moved over to the Department of Health, where I now work in the Bureau of HIV, STI, and Viral Hepatitis as the client services manager that I mentioned at the beginning. And then my big interest is we are the Part B, so we cover the whole entire state. However, our Part A, which covers the surrounding counties in Cleveland and Cuyahoga, it's very important for us to be involved, to know what's actually happening on the ground, not just to hear from our partners in Part A, which they're doing a great job, but also to hear from the community. So hear about concerns that they are experiencing and trends that they may be noticing that we haven't even taken a look at.
Okay. What would you consider to be the greatest success of the council since you began your service?
I honestly think the greatest success is the fact that there is such a vibrant council. I know that you asked since I started, but the planning council that y'all have, I shouldn't say that on public record. It's very good and it's very vibrant and the community is genuinely involved. And that hasn't diminished despite COVID and despite being virtual. So I think that would be the most amazing thing. And then since I started would be more open communication between Part A and Part B.
Okay. And what about the most pressing issues facing HIV positive individuals in this community? What is happening on the ground?
I think one of the biggest struggles and challenges is grief and isolation. A lot of our individuals from COVID, from MPOX, with everything that happened, there was a lot of feelings of being isolated, of being ignored. We saw a lot of basically PTSD, so people having flashbacks when they were isolated from their support systems. So I think the biggest challenge facing individuals who are living with HIV is grief, isolation, and the stigma attached to the diagnosis that still exists.
Thank you. I'll open it up for questions from my colleagues. Councilman Miller?
Madam Chair, Ms. Ruiz, thank you very much for serving on this very important council. And my question is, does the Ryan White program pay for people's HIV treatment, or do people have to get treatment through their own insurance?
So it's a blend of different things. The Ryan White program, and I'll speak specifically for Part B, you have to be from Ohio, or you have to live in Ohio, you have to have HIV, and then you also have to have a federal, be within the 500% of the FPL, so the federal poverty level or below. And from there, if you qualify and you're eligible for services, then we would either, if you have insurance, we would work with your copays, maybe we pay your premiums. If you don't have insurance, then we would pay for the medication itself directly. So I will say that there is a lot of work behind the scenes to expand those services beyond the 500% FPL.
And in Cuyahoga County, is the number of people with HIV/AIDS currently increasing, decreasing, or staying about the same?
So overall, we have seen, so I can talk about the numbers that we're seeing behind the scenes, and then I can also talk about the official public numbers as well. But we're actually seeing kind of a steady, we were seeing a bit of a decline, but now there's more testing happening. So we are seeing a slight increase, which sounds like I said two different things, but which is making it kind of even. So we, in the state of Ohio, we average around 1,000 cases of HIV, new cases. That dipped for a bit, but again.
Is that per year? Is that per year? 1,000 cases?
Oh, for the whole entire state.
Is that per year?
Oh, yes, yes.
Okay.
We're a little bit lower. We're looking at around 800.
Okay.
Thank you. Councilwoman Conwell?
Thank you, Madam Chair. To Ms. Ruiz, the last time this group came before us, there was a young gentleman, and I can't remember, but he talked about an app that was created, I think it was new, and it was being created for individuals to reach out for help. Can you refresh my memory and this committee's memory on that?
Yeah, I think you're referring to Positive Peers app, which is from Metro Health. It's a wonderful app. It was created because they received one of the SPIN grants. So basically it's an innovative grant that they received, and they use that to create this app. And it's for, I believe, 13 to 35-year-old individuals living with HIV. The minors are separate, obviously, from the adults, and it's for them to reach out, to have community, to basically ask questions, again, going back to that grief and isolation. So it's a wonderful app, and it's
Okay.
actually nationally being recognized.
Oh, okay. Thank you.
No problem.
Just very briefly.
Councilman?
Thank you, Madam Chairwoman. It's nice seeing you, and thank you. When you answered Dale's question, or Councilman Miller's question regarding the current 800,000-ish, what was it at its peak? It was absolutely terrible at one point. It was an epidemic or whatever. Do you have that number? Is it?
I don't have that number. I can tell you that the state of Ohio, we have around 28,000 individuals living with HIV. And we average in our program, again, going back to the FPL, we average around 5,000 a month.
Okay.
That needs services.
Thank you. I was just, because when I was growing up, I'm like, this is really, really bad. And over time, it's been getting preventable, treatable, and I'm glad it's going in that direction. So thank you.
Absolutely. Thank you.
Along the same lines, I was wondering what are our numbers versus the other counties, Ashtabula, Geauga Lake, Medina?
Actually pull up that data request. So one thing that the Planning Council has been really good about doing is every year they request they have a data request. Let me send it to Lisa. My apologies as I pull it up. But we have a data request that highlights how many individuals are using these services. And I can also defer to Monica or Zach as the Part A for a better number. Let me see.
Yes, please come forward. Please state your name for the record.
Madam Chair, council members, my name is Zach LeVar. I'm the Deputy Director at the Cuyahoga County Board of Health, which oversees this Part A program and Planning Council. So to answer your question, I would say about 85 to 90% of the new infections that we see of HIV happen in Cuyahoga County. And then it is drastically different on Lorain, Medina, Ashtabula, Geauga, and Lake. Still enough that we need to serve those populations, but I would say that about 85 to 90% annually are within county limits. And to answer the previous question that I think Carla was looking up, we did see a little bit of a spike in new infections during the early years of COVID. We'd like to hypothesize that that was because there was more people that were accessing care out of fear of COVID and actually finding out that they may have been HIV positive. As well as the Ending the Epidemic program that you may be familiar with that started in 2020, which brought a new influx of funding into Cuyahoga County to test new innovative methods of treatment and prevention. So we were able to expand our prevention services and testing services to more non-traditional settings and things like that to widen our catchment area of those that may need services.
Can you repeat your name and your title again?
Yes, Zach LeVar. I'm the Deputy Director of Population Health at the Board of Health.
Carla, that was like phone a friend, but he was here.
It worked out.
I don't
This is
think-
what I talked about,
yes.
Part A and Part B partnership.
I don't think she was actually looking at anything on her computer. I think she was texting me for the answers.
Love it. Councilwoman Conwell.
Through the chair to Ms. Ruiz or Mr. LeVar, can you elaborate on where all the funding sources come from for the regional HIV prevention? The funding that you get, I'm so used to calling it Ryan White, so can you share where the funding sources come from?
Yes, I can take that one if you'd like. So we received the Part A funding, Part B funding as well from HRSA at the federal level. And we also received the prevention funding through CDC and through ODH at the state level. Those are the two biggest payers for HIV prevention and care services.
Has that funding decreased?
No, it's actually been pretty stable over time. The Part A program's been here since 1996, and it has increased since 1996, as everything has financially over the last 25 years. But over the last 5 or 10 years, we've been hovering around 4.5 million. In the last couple of years, it's went up to about 4.8 million locally for the Part A program.
Does that money come directly to the Board of Health? Okay, and so you disperse it amongst how many counties?
6 counties. We currently have 13 providers of services, so all the major medical systems in Cleveland, as well as some smaller clinics, some outlying medical clinics in Lorain and Lake. And yes, so the vast majority of that goes directly into services for those entities.
And if some of those numbers should go up in some areas versus others, is the funding shifted that way?
It is, and that's really the key point of the Planning Council that Monica was speaking to earlier, is that they really know what the community is needing at the time, and they're actually in charge of what we fund and how we do it. So on our end, our major job is to find the folks to do the services. But we are advised by the Planning Council, which we greatly appreciate on what the community needs.
So in terms of insurance, are individuals still, well, I guess, is insurance companies denying them, or has that kind of weeded itself out?
It does happen, and that's really the role of our Part A and our Part B program, is to make sure that nobody is out of luck when a Medicaid lapses or an insurance won't pay for a service. We really are, we're considered a payer of last resort program, so we make sure that anybody that is in need of treatment can get treatment, whether it's through their insurance or through our program across the 6-county region.
Is that an easy process through the chair? Is that an easy process for the individuals?
We try to make it as effortless as possible. Sometimes it requires some paperwork, annual paperwork, but we try to make sure that we're not asking clients to really have to do a lot more than necessary to access these services. And I can only credit that to our case manager network here, the social workers that really make those processes seamless for clients to the best of their ability.
And at one time, there was a rise in seniors, and then there was a rise in the youth. Has that kind of stabilized itself out, or is it still a specific group that you could say is higher?
Yeah, so most of our infections currently are happening in youth, but we are also seeing that we are having a growing aging population living with HIV, just to the credit of the treatments that are allowing people to live longer, healthier lives with HIV. So our Planning Council actually did a deep dive on HIV and aging recently, and it's definitely at the top of our priority list from a funding perspective to make sure that services are accessible, meaningful, and useful as people age with HIV.
Thank you. Any other questions for Ms. Ruiz or Mr.? Okay. All right. Well, thank you so much for your desire and commitment to this community to improve lives. We're grateful for your service on this council, and may I have a motion to move this forward?
Madam
Second
Chair,
reading?
can
Yeah.
I ask Ms. Ruiz how long she's been, I see this as a reappointment, how long she's served on this regional HIV prevention?
Yeah, it's been 3 years. I started at the state in 2021.
Thank you.
Any further questions? Okay, I'll make the motion to move this item to the full body of council for second reading approval on the suspension of the rules. Can I have a second?
Second.
Been moved in second. All in favor?
Aye.
Those opposed? Unanimous. Thank you. Ms. Ruiz, you have a great day, and again, thank you for your service.
Thank you so much. Have a great day, y'all.
Thank you.
We'll now return to item 5B on the agenda. And Madam Chair, Council Rule 9C allows for the reading of very similar items by abbreviated titles. Therefore, items 5B through I will be read into the record by abbreviated titles if there are no objections.
There are no objections?
Resolution 2024-0150, confirming the county executive's appointment of Tiffany Green for the term April 1st, 2024 through March 31st, 2027.
Madam Chair, on behalf of the county executive and pursuant to section 6.04 of the Cuyahoga County Charter, I'm here to recommend the appointment of Tiffany Green to the Cuyahoga Regional HIV Health Services Prevention and Care Planning Council to a 3-year term that started on April 1st, 2024 and will end March 31st, 2027. She will be replacing Jeannie Cederman-Krager. We are requesting a second reading suspension. Thank you.
You're welcome. Thank you. Good morning.
Good morning. Tiffany Green. So I am the HIV STI project coordinator at the Cleveland Department of Public Health and our Health Equity and Social Justice Division. I've been here almost 2 years at the Department of Health. Prior to coming here, I was at Planned Parenthood of Greater Ohio, where I provided comprehensive sex education in a community-based setting and also in the school health. And I also managed our HIV STI grants that we had. Coming here, wanting to serve on the planning committee just aligns with my personal and professional goals. And so one of my passions is to reduce health disparities in my community and also reproductive health. And so becoming the HIV/STI project coordinator, again, just aligns with my personal and professional goals. In the HIV/STI programs, I'm over our HOPWA and our CDBG grants. And our HOPWA is our housing opportunities for people with AIDS. And then our CDBG grant is our Community Development Block Grant, which is more of our prevention. Serving, if I'm able to serve on this committee, it's going to just help me with like the decision-making process with policy and also programs in ending the HIV epidemic.
Okay. Thank you for that introduction. What do you believe are some of the most pressing issues facing HIV-positive individuals?
I would say housing is one. I look at housing as prevention. And if we could get our clients into stable housing, it can help them with their health outcomes, right? And so I think housing is very important for us. And if we could get that under control, individuals could be able to have like their access to their medications or their treatment. So I think housing is one.
And what's the barrier?
Affordable housing. Oh, I say affordable housing.
Lack of.
Lack of, yes. Lack of housing, affordable housing, safe. Housing is another barrier.
Open it up for questions to my colleagues. You are being no, this is your first appointment.
Yes.
Okay. Okay, well, I can't ask you that question, and I think you've answered the others. Did you talk about your interest? Why you want to serve on this council? What the work that you're doing with the city? How can you marry what you're doing with the city with this council's work?
Just in collaboration, like we do work with the Board of Health. So collaboration, working with partner agencies in the community like AIDS Task Force, Eden, Nueva Luz, We Think for a Change, that provides those services to our community. And so I think my role again is like establishing like those partnerships in the community so we could have just to provide like HIV services to the individuals who need it, to like a sense so we can hopefully end the HIV epidemic.
Okay. Well, thank you for your willingness and your desire to serve in this space. And
Thank you.
we look forward to seeing more of you. I'll make the motion to move this item to the full body of council for second reading approval under suspension of the rules. Is there a second?
Second.
It's been moved and second. All in favor?
Aye.
Aye.
Thank you.
Okay, thank you.
Resolution 2024-0151, confirming the county executive's appointment of Lorsanya Moore for the term April 1st, 2024 through March 31st, 2027.
Madam Chair, on behalf of the county executive pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the appointment of Lorsanja Moore to the Cuyahoga Regional HIV Health Services Prevention and Care Planning Council to a 3-year term that started April 1st, 2024 and will end March 31st, 2027, and she will be replacing David Smith. Thank you.
Thank you. Good morning.
Morning. My name is Lorsanja Moore, and I am a registered nurse. I have been working with Cuyahoga County for 25 years this year. I have served in different roles, case management, training officer. I've also done quality control. Currently, I am the Assistant Director of Nursing, and we provide home care services to all of the residents in Cuyahoga County.
Well, thank you, rock star. Can you talk about what you believe to be some of the most pressing issues facing this population?
I believe the pressing issues has to do with their home environment, being able to have services to help them age successfully in their homes. So right now, there is a national shortage of home care assistants out there, and the services are so important. It's because of that shortage, it makes it difficult for those who need services. One of the things that's important is providing personal care and homemaking so that they can live continuously in their homes, and cleaning environment is important to their health. You know. The other issue, though, that they have is transportation, having access to the services that are provided throughout the county.
Okay, any questions from my colleagues? Any thoughts around solutions? Let's talk transportation.
Wow.
And you might not, but
No, not on transportation. More so, my focus is on the home, because that's your place of serenity, and you should be more comfortable. And one of the issues is, like I said, we provide personal care. It's very important that, first of all, that the service is available to them. Also, that they feel comfortable. You know what? HIV, it's that stigma around it. People feel shame, there's blame. And so first we have to help them mentally be able to deal with their situation, And so if someone's coming into the home, I need them to be educated on what HIV is, how it's transmitted, how to prevent it. Because I want them to be confident in servicing them and make them feel comfortable being in their home. Sorry.
so Ms. Moore, tell me what you, and this is my final question. Tell me how you envision your role on this council.
Yes. So one of the things that I think I can make positive change, okay? First of all, dispelling the myths surrounded by HIV, okay? Again, educating my staff about the disease process and how we can best help the clients that we serve. The other thing, connecting our clients with the resources that are available out there in the community. A lot of times people don't know. Okay? Helping individuals, again, feel safe and showing compassion to individuals.
Do you serve on any other boards or committees?
No, I am a member of Sigma Gamma Rho sorority, and we help in the community.
Okay.
Yes, in the community. And so I just, I care. I care. I've been caring since 1986. When I was in high school, I was a junior in high school, and I wrote a paper on discrimination against people that AIDS, and how it's unjustified, I have family and friends who are dealing with HIV. I have friends whose parents have HIV. It has changed. It is not the stereotypical what you thought was homosexuality, gay males, things of that nature. It affects everybody, It affects children, single individuals, married individuals, heterosexuals, And so that could be me. And I would like to know that there's resources out there available to me, that somebody can support me and help me get through this. It's not a death sentence, and I want to live a productive, quality life like everyone else.
Well, caring is the only ingredient that you really need to serve in this space. Thank you for stepping up. We look forward to hearing more about your experience. And I'm going to open this up for questions. Councilwoman Conwell.
Thank you, Madam Chair. To Ms. Moore, you stated that there was kind of a national epidemic, so to speak, on the shortage of personnel that want to just be homemakers in general or come into people's homes. Do you think that it's harder for you because the individuals have HIV? Or is it just a national thing?
It's a national thing. Yeah, it's a national thing.
And do you have to, I know in the healthcare, I probably know the answer to this, but for the individual's HIPAA requirements, do you have to disclose to the employees that these individuals, if they come in their home, have HIV? Do they have to know? I don't know if they administer medicine or what, I don't know.
So we do make sure that the home health aide is aware of who has HIV. It's important because, again, precautions, infection control, which we should be doing with everyone, but particular with them, we want to make sure they're safe.
All right, thank you. Thank you for your service and your passion.
Any further questions? Which chapter you belong to? Who's
Alpha
your
Lambda.
boss list?
Alpha Lambda Sigma.
Who is the president or
So, right now, I'm drawing a
the
blank.
Judge Mays or?
Yes, just Lassiter Mays.
Okay, all right. We heard from them not too long ago, had a drain keepers program, cleaning the drains, keeping the sewers from flooding. So thank you for your service all around. Again, we look forward to hearing about your experience a little later, and thank you for serving. I will make a motion to move this to the full body of council for second reading and approval under
Second.
suspension of the rules. It's been moved and seconded. All in favor?
Aye.
Thank you.
Resolution 2024-0153, confirming the county executive's reappointment of Billy Gayhart Jr. for the term October 28th, 2023 through October 27th, 2026.
Madam Chair, on behalf of the executive and pursuant to Section 6.04 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Billy Gayhart Jr. to the Cuyahoga Regional HIV Planning Council to a 3-year term that started October 28th, 2023 and will end October 27th, 2026. Thank you.
Well, good morning.
Well, good morning. My name is Billy B. Gayhart Jr. Pardon me, my allergies are really bad today. I am a person living with HIV for several years. I'm not affiliated with any agency or company, medical center, or anything like that. I serve for myself, number one, because as a person living with, I do receive funding services through a Ryan White program. But I also, being part of the community, I see all the disparities, all the problems that people are facing every day. I have conversations with people, so I like to be a voice for those that don't really have a voice. And I have been serving for 3 years, even though I started probably about 4 or 5 years ago attending meetings and things like that, but officially 3 years. And this is my second term, and I'm looking forward to it.
Thank you for your service.
Thank you.
Can you talk a little bit about some of the greatest successes that you've seen during your first term and maybe some of the greatest challenges?
Well, success is the outreach that, with everything that we are doing, we do surveys, we do, outreach to the community. We have conversations with the state. We have conversations with, other people. And it's really nice to see that we're actually making an impact and reaching out to those that really need the help. Some of the barriers that we're facing, which you've already heard before, I kind of like to see it as kind of two issues that we're facing right now. People are aging. Like myself, I'm 54. I've been living with HIV for several years, and as we're aging, because of the advancements with medicine and treatment, I've also had cancer. I've also had 2 heart attacks, And for those that don't know, when you're HIV positive, living with HIV and AIDS, those issues that people normally face we get hit with them on an average of 10 years earlier. So with the advancements with medicine and treatment, we're aging and we're facing more problems sooner than most people do. The other part is the infection rate that is going up right now. We're seeing an increase in a very specific category, young black MSM. And MSM means men who have sex with men. So we have the aging side and we have the youth. How are we trying to approach those things? And a lot of the issues, especially with the youth, which you heard earlier, is housing. People that don't have housing, stable housing, safe housing, a place to lay their head, they're not going to care about their medicine. They're not going to care about going to the doctor because they're worried about where am I going to lay my head. So a lot of things with the youth is the housing and trying to have that, conversation with them, how important their treatment and their medication is. And those that are living older and aging with HIV still got the stigma. You still have the issues where loneliness starts setting in because people look at us different. Oh, I don't want to deal with that old person, this and that. So we kind of get isolated. We kind of get withdrawn. And so we're constantly battling those things too. So.
Thank you for sharing. Any questions from our colleagues? Councilwoman Conwell?
Yes, Madam Chair, to Mr. Gayhart, I was looking at a statement here, and can you share with us where the Ohio Integrated Plan, the 5-year plan is at? What stage is it?
Well, we just finished the planning process. I do not know specifically where it's sitting at right now. That is through the Ohio State, so the Ohio Department of Health. But I believe that we're waiting back from HRSA and CDC for approval, and we're getting ready to start the implementation part of things.
Okay, and so how would this, once that is completed, how would this council see that plan? Is there anyone that can make sure that we get the plan?
Well, within our planning council, we have different subcommittees. One of the subcommittees, what we call it quality improvement, that's kind of part of their duties is they collaborate with the Ohio Department of Health and the integrated plan. So we'll get a lot of feedback from there. Carla Ruiz from Part B, she gives us an update. And I actually know the lead person from ODH. Her name is Kate Shoemate. I have her on speed dial. So I'm constantly calling her.
All right, so that's our request is once that integrated plan is completed, to send it to our clerk.
Zach and Monica, that's the best person to ask that.
Okay. Thank you for your service, Mr. Gayhart.
Thank you.
Mr. Gayhart, it's mentioned that you serve as chair of membership retention and the marketing committee. And I wanted your thoughts around, since you shared that data piece about the infection rate and where it's growing the most, that community of Black men. Any thoughts on how we can do more outreach?
Well, we
in that
actually do have
community?
members that have a very close connection. And there's a part of the LGBT community that we call ballroom scene. So we actually get involved with that.
Ballroom scene?
Ballroom scene. So it's kind of like a dance competition, young men get to show off their talents and things like that. We do have a connection with that. One of the things, because I am chair of the membership committee, I'm kind of trying to approach an idea to where we actually create another committee that is strictly for youth, because we want to bring those youth in. We want them to come to the table and tell us about the situations that they're going through, their barriers, their, the gaps that, they want to receive treatment for, and having that conversation, but giving them a space to do it safely and comfortably.
Well, I hope that happens. We'd love to hear more about.
They're working hard on it.
Okay. All right. If there are no further questions for Mr. Gayhart Jr., Is there a motion to move this item to the full
I'll make-
body of council for?
Second reading
Second reading.
suspension. I'll make that motion,
It's
Council.
been moved, it's been seconded, all in favor?
Aye.
Okay, thank you.
Resolution 2024-0156, confirming the county executive's reappointment of Naima O'Neill for the term April 1st, 2024 through March 31st, 2027.
Madam Chair, on behalf of the county executive, pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Naima O'Neill to the Cuyahoga Regional HIV Council to a 3-year term that started April 1st, 2024, and will end March 31st, 2027. And we are requesting a second reading suspension. Thank you.
Good morning.
Good morning. My name is Naima Sheree O'Neill. I am actually a convicted or conflicted consumer. And what I mean by that is that I, not only do I've been living with HIV for 31 years, but I also work in the field as a social worker. So my agency receives Ryan White funding, so that makes me conflicted. And all that it means is that I can never really pursue my own interests. I can be a guiding force because I serve on the Community Liaison Committee, which is the consumer or people living with committee, and along with another coworker, or I call her coworker, but we're very close. We serve as chairs together. I have been living with HIV again for 31 years. I've been serving on a Ryan White Planning Council for years. I've been a social worker working with people living with HIV for about 15 years. And I think that I enjoy the work that I do as a social worker, but also as a woman living with HIV, because I lend that voice to women who may not be able to have a voice. Because we all know that women have a lot that they have on their plate, including family, including work, and sometimes including living with illnesses like HIV.
Can you talk to us about We Think for a Change?
We Think for a Change is a program that I currently sit on the board for, the advisory board. We Think for a Change is a grassroots nonprofit organization that is ran by people living with HIV. So we do webinars, we provide programs for people living with HIV, whether it's women, men, children. We do a lot in the community to provide that services that agencies like myself might not be able to do because we're grant funded. And so this agency provides funding, gas cards, bus tickets, in addition to what other services in the community may offer.
Okay. You may have told us this already. Most pressing issues facing?
To me, the most
population.
pressing issue is that are not enough people living with HIV sitting at prominent tables. I think that the places that make the decisions is where people living with HIV should be sitting. We know how to take care of ourselves. We don't really need anyone to take care of us. We do need help, however, to provide people living with HIV with resources that is necessary to help them maintain their life. Because now people are living longer with HIV. So 61 years for me, and 31 of those have been living with HIV. So, enough said about that.
Any questions? Okay, well, Ms. Naima Sheree
Sheree.
O'Neill, thank you so much for your service. Any
Thank
final
you.
thoughts?
No final thoughts other than I enjoy the work that I do. I hope we can bring young people on board. And if anyone has any questions after that, don't hesitate to not ask. Thank you.
All right, thank you. Thank you. I will make the motion to move this item to the full body of council for second reading approval under suspension of the rules. Is there a second?
Second.
It's been moved and seconded. All in favor?
Aye.
Thank you.
Resolution 2024-0157, confirming the county executive's reappointment of Julia Patterson for the term October 28th, 2023 through October 27th, 2026.
Madam Chair, on behalf of the county executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Julia Patterson to serve on the Cuyahoga Regional HIV Council for the term that started October 28th, 2023 and will end October 27th, 2026. We are requesting a second reading suspension. Thank you.
Morning.
Good morning. Chairperson Turner and other members of the committee, thank you for inviting me today. My name is Julie Patterson. I know we said Julia, that's my legal name. You can call me Julie. I serve as director of the AIDS Funding Collaborative, also known as the AFC, here in Cuyahoga County. And as you may know, the AFC's mission is to strengthen the community's response to HIV and AIDS as a public-private partnership which provides coordination, leadership, advocacy, and funding throughout Cuyahoga County. Excuse me, like Billy, I have allergies, so apologize. We actually have 6 funding partners. It includes, as I mentioned, both public and private. So on the private side, there are 3 foundations. So the Cleveland Foundation, the Mount Sinai Health Foundation, and the Gunn Foundation. But also on the county side, we're honored to say that one of our key funding partners, on the public side, is Cuyahoga County through a contract with Cuyahoga County Health and Human Services. It also includes the Adams Board, who we talked about earlier this morning, and also the City of Cleveland through the Cleveland Department of Public Health. Sabrina Roberts, who you all know is the senior advisor to the county executive, serves on our AFC advisory committee and has done so passionately for many years. You may also be aware that the AFC is fiscally and administratively housed inside the Center for Community Solutions. And this is a perfect match for our interests in advocacy and also their focus on advancing health, social, and economic issues. I actually have an employee status with both. So our efforts align well regarding behavioral health, Medicaid, and also the Health and Human Services safety net. I'm here today because I also serve as co-chair of the Strategy and Finance Committee and as a current member of the Cuyahoga County Regional HIV Prevention and Care Planning Council. So my term of service is up for renewal for a 3-year period, and I would very much like to renew. I've been involved in the fight against HIV since the early 1990s when I started as a VISTA volunteer working at an AIDS service organization on the West Coast. Throughout my career, that has involved work within nonprofit organizations, academia, local public health departments, and consulting. I've continued to be involved both professionally and on the sort of personal side in HIV-focused work. I'm actively involved as an HIV prevention advocate, a research advocate, and as a volunteer. I believe I can continue to contribute expertise in public health and a great deal of experience in HIV/AIDS-related planning and community engagement over many years. Plus, I represent a community within the Grant area that does not have other representation on the Planning Council, as I'm a resident of Geauga County. Lastly, I just want to say what an honor it has been, excuse me, I always get choked up at this point, but continues to be for me to serve as a member of the Planning Council because of the magic that happens in that space. As you heard about from my fellow Planning Council members today, I'm a huge fan of community leadership and also a big believer in something we call the meaningful involvement of people living with HIV. Also, including, as you heard, other people who are heavily impacted by HIV, including our local Black and Brown communities and our LGBTQ+ communities here throughout Northeast Ohio. I learned so much from the others who are involved, in the Planning Council because their voices are raised and heard at every meeting. And I look forward to answering any questions you have, and I promise I won't be choked up when I answer questions. Thank you very much.
Jules.
Jules, that's right. You
make me lose my eyelashes this morning. I didn't bring any glue.
Chair, while you're getting yourself together, can I ask a
The woman
question?
count.
Through the chair to Ms. Patterson, you went over the funding sources. Are there any funding sources coming from the state of Ohio?
To the AIDS Funding Collaborative?
Right.
That's a good question. Only those that may channel through one of our public funders. Right now, it's not really through the state of Ohio, I don't believe, but the CDBG for HIV prevention funds that you heard Tiffany Green speak about. Those are actually the way in which the city of Cleveland is able to be a funding partner member of the AIDS Funding Collaborative. But those are HUD funds, so I believe they're coming straight to the Office of Community Development from Housing and Urban Development. So I don't think they're coming through the state of Ohio.
So your this council doesn't have any lobbyists lobbying?
No, we don't.
State of
You know,
Ohio?
the Center for Community Solutions actually does have access to a lobbyist and does advocacy work, but the AIDS Funding Collaborative does not have a lobbyist.
Okay, and so that partnership, they're not able to get any funding. I'm just thinking this is widespread across the state of Ohio. There should be some funds dedicated for treatment for individuals.
Yeah, thank you.
Councilman Sweeney?
Thank you, Madam Chair. Welcome. Your eyes lit up when you said you do it because of the magic. And the magic is saving people's lives and helping them with their quality of life. Or if you want to expand on it, I wouldn't mind hearing the most important thing.
Yeah.
And understanding what the magic is.
Yeah, I think the magic comes in through what I mentioned before, which the involvement of the people involved. And particularly, I was mentioning the Planning Council, but I think it cuts across many of the ways in which the HIV service system works in our community. In that, as Naima mentioned, people who are living with HIV really should be at the forefront of the response. And I think that's built in some ways, especially with the Planning Council, but we have to make sure it happens. And so when that happens, I think it really does bring about much more effective work, much more collaborative work, which is built into the way the AFC works. But I think it means that I was thinking you might ask me about what is the biggest challenge in our community. And I actually think that stigma in many ways is a huge issue regarding HIV. I mean, we have all the tools to end the epidemic. We have incredible biomedical prevention and treatment options for people. But a lot of time what keeps them away is stigma. And one of the best ways to fight that is, I think, through folks knowing other people and seeing how strong they are, seeing how involved they can be in their own health, their own quality of life, their own longevity, and then it changes everything. So it makes a huge difference.
And through the chair, thank you, because I never heard the board, the magic is the board and what they do from it. So I never heard it described that way, and it's watching you perk up when you said it, it was pretty cool. So thank you.
Thank you.
I think that's a great way to end this. Thank you for your desire to continue to serve and knowing that you have more to give in this space. And so thank you for your empathy, your passion, and your compassion. I will make the motion to move this forward to the full body of council for second reading approval under suspension of the rules. Is there a second?
Second.
Moved and seconded, all in favor?
Aye.
Thank you.
Thank you.
Resolution 2024-0158, confirming the county executive's reappointment of Faith Ross for the term October 28th, 2023 through October 27th, 2026.
Madam Chair, on behalf of the county executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Faith Ross to serve on the Cuyahoga Regional HIV Council for the term that started October 28th, 2023, and will end October 27th, 2026. We are requesting a second reading suspension. Thank you.
Good morning. My name is Faith Ross. A little bit about me is I moved up here 6 years ago from Houston. I moved up here because I wasn't getting the help I needed down there. And when I came, I was very sick. Obviously, I'm a person living with. I am a co-chair with Naima on the CLC. And the reason I wanted to join was after I started getting the help I needed, I wanted to make sure that other people who were having a hard time navigating all the services offered, we can spread awareness. So my passion lies there. And then my other passion is addressing stigma. I'm actually an author, and I have between 1,500 to 2,000 readers. And this year, I'm actually working on a book to address the whole stigma issue of HIV.
The name of you published already?
Kind of, sort of. I'm on different platforms, but this one I will be publishing on Amazon, Kindle, and to have it actually printed.
Make sure you share that with us.
I will once it's completed.
In your role serving as co-chair, do you have any success stories, any great stories or successes or challenges that you would like to share?
Since I've started with the Planning Council, one of our biggest tasks has been to get consumers and people living with to give us feedback on what exactly their service needs are. And one of the biggest things that we do is the consumer survey. And I will say the hardest part has been getting them to actually take the survey. Over the last couple years, we have seen a drastic improvement on the people who have been filling it out. This last year, we have surpassed all of our expectations, and that is something that the whole Planning Council, mainly the CLC, is very proud of. And the other thing that we have been doing that I consider a win is that we have been going out more into the community and being the face of the Planning Council and having those discussions and educational opportunities for people living with. Like last year, we went to the Lorain County Pride event in Oberlin, and that was very successful. And the people that I attended with, we had a blast, and we got to meet and speak with so many different people, and it was just exhilarating.
Okay. Would you know, is there any opportunity within the budget to provide some type of incentive for the completion of the surveys, like a gift card or?
I do not. That's not an area that I even remotely want to touch. I'm more just want to be the face, and I just want to, touch like I said on stigma and get the awareness of the services we provide out there.
Okay, I'm just throwing it out there. But
I'm sure Zach and Monica can address that. That's their area, and I like to keep it with them.
we have total faith in you.
Thank you.
Any questions for Ms. Ross? Okay, well, thank you again for your willingness to continue to serve. Looking forward to hearing more about your works. Okay. All right, seeing as we have no further questions, I'll make the motion to move this item to the full body of council for second reading approval under suspension of the rules. Is there a second?
Second.
So moved and seconded, all in favor?
Aye.
Aye. Thank you.
Resolution 2024-0160, confirming the county executive's reappointment of Stephanie Washington for the term October 28th, 2023 through October 27th, 2026.
Madam Chair, on behalf of the county executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Stephanie Washington to serve on the Cuyahoga Regional HIV Council for the term that started October 28th, 2023 and will end October 27th, 2026. We are requesting a second reading suspension. Thank you.
Thank you. Good morning.
Good morning. My name is Stephanie Washington. First of all, I would like to say I'm an 11-year recovery addict from drugs, crack cocaine, and alcohol. Also, I've been living with HIV since April of 1992. And I am a person that ran in and out of penitentiary. I was homeless, I have mental illness, and that's why I wanted to come again when I first got applied through Sharon on the board. I came in as a person coming home from prison, seeing other people living with HIV that's going to prison, not getting the treatment that they need because they didn't have the voice to speak out. I seen a couple of inmates of mine die behind HIV and AIDS in prison. And when I came home, due to my drug choice of me living with HIV and was in denial, I seen a lot of homeless people that was living with HIV that didn't care nothing about, but if they homeless and they got a mental illness and they got a drug addiction problem, they don't have a place to live, so that's where they're gonna run to, back to the drugs. You could put them in any type of treatment, including me, I'm guilty for it, put me in any type of treatment it was. I didn't have a stable home, so I didn't care nothing about that. I would go find what I wanted because at the time I was in denial. I lived in denial with being HIV positive for 10 years. And I have to give thanks to my doctor, Jennifer Hanahan, who woke me up. I'm a standing living miracle right here. 2014, I went into a crack cocaine coma. I had turned from being HIV close to being AIDS within the span of 6 months. If it wasn't for her snapping me back to reality, putting me into the dual diagnosed Dr. Yogley at Metro Hospital, and also the social workers at Metro Hospital, they had came out with a program of Thinking of Change. And that part of my life woke me up where I could think to change and made me want to stand out and help people that dealing with HIV, dealing with all types of mental illness, dealing with drug abuse, and dealing with homelessness. I wanted to grasp with those people. Over the terms that I've been in here, I came across a lot of people, and I'm a resourcer. I go to the resource. I help them out. They call me. I fall around for them, and I try to find the information out for them, which me being on this board is very important because I'm living with this. I've been through all these traumas of every stage that I'm speaking of. I experienced everything. And the most part of it, I love the committee board. I love where I can go talk to Jason Manning, my social worker. He's on the board. I could talk to any one of them, Zach, any one of them, whatever the problem is, they listen, they understand. So I know I have a big mouth and I have a voice. I'm not saying that. I'm 55 years old. I can be evangelism to want to help people like me, living with me, get all these type of illness, all these disease affected. But some of them, as living with HIV, are afraid to just want to take the patient
in a time when you have a disease, mental illness, or crack cocaine, alcohol, you don't want to take the patient the time to wait for someone to find you housing. All you got case managers that want to find you housing, but when your disease and your mental illness is messing with you, and you bipolar, or you ADHD or whatever, and that disease get to calling you, you'll drop and say, forget that. Well, I'm not going to see no doctor. Because I had stopped going to see my doctor for a whole year once I took myself off all my medicine and got onto the street drugs and was out of compliance for a whole year. That's where we need help at with the board to pull these people in that's homeless. If you can get them stable in housing, maybe they will feel comfortable. They stable. They don't have to run back to their friend's house. Where's that? They can get their self together like I did, you know. And being a mother of 5, a grandmother of 23, and a great-grandmother of 2, I did that. I took my family through it all. My mother, everybody. With my disease and me living with HIV, I had a stigma. I am not afraid to tell it. When I first came out with HIV, my family had a big red X on me. I couldn't go to their house. So being known that you have HIV and you know you're dealing with all types of drugs problem, and the person put a big X on you, where are you going to run to? Where you can leave your problems. Okay, I can run to this, and I ain't got to worry about this over here. But once that's gone, you got to deal back with you living with HIV. Now you homeless. Now you out there. You don't know. It's plenty of people that's out here and plenty of people that's coming home from prison that doesn't know nothing about. They go to prison, find out they're HIV. That's hysterical. So they don't know when they get out to go to get resources. So all they know to the resource is killing themselves and end up, they might got HIV, but in the 6 or 7 months, they dying off with the AIDS. And that's with the young youth too. That's why so many of these young youth out here are on all types of these types of pills and all this and all that, because they crying out for help and they don't have no one to help them. And that's why I think the board come in at, and people that living with HIV come in at, that we can go and have a structured conversation and find out, you know, what a person dealing with and try to have resources to help them. If I was reelected, that's where I want to go. I want to be right there if I was reelected.
Thank you so much.
You're welcome.
Wow, Ms. Washington, there is power in your voice, and thank you for using it. We want you to keep using it. Thank you for your authenticity, your transparency, and being unapologetic about who you are. You talked about the importance of your doctor's role in your recovery and what a dual diagnosis meant for you. Can you talk a little bit more about that?
Dual diagnosis?
Yeah.
Dual diagnosis is a person that's dealing with mental illness and also have a drug and alcohol problem. Like for me, I'm bipolar, I'm antidepressant, I'm PTSD. Okay. And I also have an alcohol addiction and a long-standing crack addiction. Now, when my bipolar kick in, my mind is racing. I tries to get in 1 hour 1,000 things done. My mouth, if you ever see me in manic mode, my mouth is constantly running. You're not understanding. I'm running. So when that kick in, my mind don't tell me, hey, go take your medicine. Hey, go take that HIV medicine. Hey, go take that mental health medicine. No, my mind tell me, hey, go get a drink. Hey, go get a crack. So you got to stimulate. With Dr. Yogli taught us, we have to stimulate. You know, we have to, regroup, stimulate, and find out how you want to do. When you find yourself that way, you go talk to a counselor, or you stop and try to pause and try to get yourself rebooted back on the way you're going. Because it's easily, I might got 11 years, but I can walk out here today and them 11 years could be gone, because I can choose to go back and drop all this, because it is a burial carrying HIV and hearing people that know you, family members, or just a stigma of anyone knowing she got it, and then there you go. You're gonna go, be our frantic, and you're gonna go back to your comfort zone. See, the crack cocaine and alcohol was my comfort zone. This is mental health. This is HIV. Okay, I know I got this, but
So through your ability to be able to access services and get help, how do you think you can be an inspiration or motivate folks that may be in similar situations as yourself? You mentioned the homeless community, for example.
yes, I would love to go out. Basically, I could backtrack that. I would love to work with the people that's coming out of going to prison. They go in, they don't think they have nothing. They do all those tests and find out that they have it. And then when they come out in society, they got it. They don't know where to go for help. And all they know is to go that way. Homelessness plays a part of getting yourself healthy. Now, if you homeless, you ain't gonna think about nothing. If you are an addict, you're not gonna think about none of that. None of that don't matter, because I'm homeless right now. What can going to the doctor do for me? What can this medication do for me? It can't put a roof over my head. That's where your mindset at. But if you get them in housing, then they are liable affordable living where some people just on Social Security, some people just don't have income that's going for many man and many man. If you get them into somewhere, if it ain't nothing but a rooming house, if it ain't nothing but something for they can get themselves back into track, like I had to start from the bottom. I had to start going to a sober house in order to get my life back on track. I had to regroup all over again. So I know what it is. I experienced it. Like the old saying, experience is your best teacher. You have to experience something. You have to walk through something to know what to do the next move. If you haven't experienced it, you don't know it. I mean, you can talk to a person till they blue in the face, but if you ain't on that side of the street they ain't gonna perceive you. A lot of people don't get perceiving because they feel like you haven't walked in my shoes. But take it from a person like me, done walked in their shoes, and I could tell them, hey, I walked in your shoes. I got a couple of sponsees that didn't know I was HIV until I did my lead in front of 200-some people, and I came out. And I was so amazed how many men and women came up to me and said, you strong for standing here saying that. And I got their numbers, and on a daily basis, I call them, I talk to them. A lot of my health challenges have backed me down a little bit from when I first started being very active into it. A lot of my challenges have done had me. I done had COVID 2 times. I'm on a procedure of getting 75% of my stomach removed pretty soon due to me battling the fence with the medication and drugs and alcohol. So it's like my burial's going as far as going outside, but I'm a voice over that phone. I'm very resourceful over that phone. I get things done over the phone, but actually me going into the community, I haven't been in there in the community over since the COVID. But I would love to go back into the community because I see a lot of my youth. I have a couple of nephews that's, I'm not afraid to say it, gay, and one of them done detected. I found out last night one of them have what I'm living with. So he came to me and we talked, and I'm going to get him into some care with a doctor or something. So that's the type of people that I hold on to. But my interest is in the people prison and homelessness and people dealing with all of those I said. That's the title that I want to walk in on this board.
Do you have any questions for Councilman Miller?
So, Madam Chair, Miss Washington, I just want to say that you have these boards, and it's very easy to fill them up with a lot of academic and medical people, but then have them not really know what's going on in the real world. But I got to say that with you on the board, I'm just so much more confident that that's not going to happen, and that we just need people that have really lived it and have really seen it. You've dealt with HIV, you've dealt with being in prison, you've dealt with mental illness. You've kind of just seen so much, and when making policy in this area, people need to hear from people that have had your kind of experience. So I'm going to enthusiastically vote for your reappointment and say to just keep doing what you're doing and be a voice for those that have really seen it and really done it, so that we can help some people and make lives better. Thank you, Madam Chair.
Thank you, Madam Chair. I just like him, ditto. Great choice of shirt.
Thank you.
Which is your favorite one?
Healer.
Which one? My
Healer,
Savior?
My healer.
My healer?
Yeah,
Mine
he's
is
my healer.
Mine is my peace. But that's a rock solid shirt. So thank you for bringing that and let me think about it.
Thank you.
Okay, well, I'm sending you away with thoughts, prayers, and blessings. Thank you for, despite all that you're going through, but using it to step into your purpose. We need your voice, and I meant it. There is power in your voice. I felt so empowered. I didn't feel anything but walking away from this meeting like I got to do something. So thank you for your service. And I'm going to make the motion to move this item to the full body of council for second reading under suspension of the rules. Is there a second?
Second.
Can you add my name and all
Been
of us?
moved and seconded. All in favor?
Aye.
Please
Please add
add
my
Councilman
name as
Miller,
well.
Sweeney, Turner.
And
Add my name to all of them, actually.
thank you for having me.
Sharon.
All the names.
For this last
Yes.
item, thank you.
Thank you.
Resolution 2024-0161, confirming the county executive's appointment of Michael Summers to serve on the Metro Health System Board of Trustees for an unexpired term ending March 1st, 2026.
Good morning. Is this the one?
Madam
Yes.
Chair, on behalf of the county executive and pursuant to the Ohio Revised Code, Section 339.02, I'm here to recommend the appointment of Michael Summers to the Metro Health System Board of Trustees for an unexpired 6-year term that will end March 1st, 2026. Mr. Summers will be replacing Robert Horowitz. We are requesting a second reading suspension. Thank you.
Thank you. Good morning.
Good morning, Madam Chair. My name is Michael Summers, and I'm very pleased to have this opportunity to serve our community, our broader community. I think about this assignment in two contexts. One is the executive responsibility of delivering a complex healthcare system, and the board's responsibility of how to support that effort on behalf of the community and the enterprise itself. And in order to meet that responsibility, I will be drawing on two very significant segments of my professional world. One is the executive side, and then significant experience on boards similar in capacity, some less so, many less so than the Metro Board of Health. I consider this assignment to be one of the most significantly important of my career, my life, and its impact is beyond consideration of its magnitude on the welfare of the people of really not just Cuyahoga County, but I think in the region as well. So on the executive side, I have two primary roles. I owned and operated a manufacturing company for 32 years, Summers Rubber, and I served as the mayor of Lakewood for 9 years. Mayor of Lakewood's job was much more complex in its scope. 500 employees, 7 unions. I learned really how to manage at a much higher level. And I'll be drawing on those experiences to help the management of Metro Health to meet their potential and deliver the services that they've committed to do. On the board of directors side, it's a different role where you're really not directly engaged, but you're supporting the organization, providing oversight, generally appropriating and assuring resources, and providing feedback and guidance to the mission. And in my capacity as a director of First Federal of Lakewood, which is a community bank, a mutual owned by its depositors, not a stock bank, and I have served in that board for 24 years. And in that capacity, it's a highly regulated environment through federal bank regulations with annual audits. And you have a duty of safety and soundness. So here in the Metro Board, we have a duty of care. But the point is there are clear duties that are assigned to board members when you have highly regulated environments. And I consider the Metro Health such an environment as well. And I'll be drawing on my experiences as a bank board member to how to understand regulators, their view, and how the management and executives can meet the expectations of those regulations. I served on the Lakewood School Board for 8 years. That's, in effect, a board of directors job. The primary goal of a school board is to hire a great superintendent and treasurer and do everything you can to support their efforts to meet the expectation of educational needs of the community. And that means providing accountability, providing feedback, running interference when it's important or appropriate, and making sure the resources are there to educate the children in the community. I served on Lakewood City Council for 3 years. Many of you have served on councils, and you're on one now. You know that's in many respects sort of a board's job. You have accountability, you have oversight, you appropriate resources, you do not directly engage, and you're often challenged to reflect on complex public policy issues and do the best you can, really from an indirect role. So City Council provides background, especially in a government context, how entities like Metro Health, as a government responsible agency, has to behave in accordance with good government. I served on the Lakewood Hospital Association for 9 years. Lakewood Hospital Association was a private nonprofit that ran Lakewood Hospital. The mayor of Lakewood has a permanent seat on that board. And that was a big assignment. We ultimately had to address the future of that hospital and the future of healthcare as it applied to the community of Lakewood in particular, and really the 4 zip codes around it. I learned a great deal about medical delivery, the future of medical delivery, the complexity and financing of medical delivery, and the competitive world we live in, and the lack of care or needs that are unaddressed through gaps in healthcare. I'll be drawing heavily on that experience. I served for 4 years as chair of the Ohio Workforce Policy Board. I was appointed by Governor Bob Taft in that role. It was a very tough assignment. That was a raw public policy launch. The Workforce Act of 1993 basically empowered states to create workforce policy systems to address the workforce needs of the 21st century. We started with really a blank sheet of paper and had to create something from scratch to whole cloth, and it was a very difficult assignment. Made headway, but not complete headway in the 4 years. That's an evolving target and remains so. So I would say that the Metro Board, to me, is critically important and essential. You know that better than I, to address the needs and advance the health of the county citizens, especially its most vulnerable. So I would seek to support the delivery of health care at the highest quality of level, and that's no small challenge in its own right, in a moving target where the needs are broad, the technology is advancing, and the understanding and application of that technology, especially at the primary care level, is essential. Metro is challenged to understand population health trends, more so than many other private nonprofit hospitals in our region. And they must advocate and deliver effective services to address these trends. And these trends are seismic in their scope and implication. We also have to create a great place to work and be successful in the labor markets to hire and retain great people. That's its own leadership culture and responsibilities that a Metro Health management has to undertake. And you have to develop and support the executive talent to achieve all of the above, and the board has that responsibility, in my opinion. My particular interests in serving this capacity are to align and make sure the alignment of vision and mission, values and strategy are working in coordination with each other. Strategies can shift as the times demand. Mission should be held close and should be adhered to. Values are important, and they also determine how decisions are made and priorities. The regulatory compliance, where appropriate, is going to be a big part of the challenge, and the quality of service and, just as importantly, continuous improvement of that service has to be a hallmark of the work. And finally, there's always an element of risk in an enterprise like Metro and its complexity and managing risk appropriately is the responsibility of board, both to understand it and guide the leadership capacity to manage it. And I would say finally that my commitment is to bring all the experiences and knowledge that I've gained. I'm 70, so I've got quite a few of them. Most of my experiences and knowledge were hard-earned, but all that would be brought to bear to advance Metro's mission. So I expect to be all in on this. It's a big commitment of time and energy, and I look forward to the assignment. I hope I have the chance to do it.
Thank you for that presentation, Mayor. Do you have questions? We'll start with Councilman Miller.
So, Madam Chair, to my colleagues, I would just say that Mayor Summers' service as mayor of Lakewood was legendary. He was no-nonsense professional, minimally partisan, went in and solved problems, left Lakewood better off, and at the proper time says it's time for me to turn it over to somebody else, and just did a remarkable job. And with Metro Health having a few bumps in the road recently, Mayor Summers is the kind of person that we really need on the Metro Health Board, and that he's capable. He has tons of financial experience. He has a watchful eye. He knows how systems work, and knows how to make large organizations move in the right direction. And I'm just enthusiastic about his appointment, and I'll just have more confidence about the future of Metro with Mayor Summers on the board. Thank you, Madam Chair.
Thank you for those comments. Councilman Sweeney.
Thank you very much, Mr. Chairman. Mayor, it's nice seeing you, as always. Everything plus about a whole bunch more of who he is. And just with joining the board, I got to give a little shout out to Chris Ronayne for the quality of individuals that's coming, that's doing the makeup of the board. And you fit in there. The familiarity with the board itself in regards to, is it 5 new people?
I think it's 5, yeah, at least 5. And to be honest with you, I have a great deal to learn about this board, how its past culture has led it to its behavior. I want to do it thoughtfully. I'm going to be asking hopefully intelligent questions guided by my experience, not with a direction of a specific outcome, but to learn. It's a small board. There's only 10 folks, I think. It's an enormous undertaking, a $2 billion healthcare system in a world that's really radically shifting under the feet of delivery. And then we have these chronic health conditions that are not unique to our particular community, but across the world that we have to figure out how to prevent better than we ever have. It's an enormous undertaking, and it's almost daunting in its scope. And we have a new CEO who needs to be supported and guided. It's a tough job that Erica Steed has taken on, and I think the board needs to work with her to be a sounding board for her, and also to draw on our experience to help her to understand how she can reach her potential to then allow Metro to reach its potential.
And through the chair, it's exciting for me. 5 new board members, a brand new CEO that has the drive and passion I've seen for the last year that she's been here. With you, you're nice and smart and all that, but you're the man of principle, and you're not going to be moved except for what you believe is right. And with you and Sharon Dumas on the board, I'm just tickled pink that we're not going to have, Metro is going to be well-run, well-represented, and it's going to grow into the shining star that we all hope it's going to be. So thank you.
Councilman Gallagher.
Mayor, welcome, and I wish you good luck in advance. The mayor of my hometown, the only one up here, I believe. And time is short, so I won't take it up. And And, but I will tell you, when I first got elected here, I didn't understand the importance of Metro because I never had to deal with it. And it took a while to get up to speed, but once we did, I can't think of another institution within Cuyahoga County that's more valuable to not just the people of Cuyahoga County and those in most need, but to ourselves. So I have great confidence that as you move forward and learn what's going on at Metro, that we're in good hands. So welcome and good luck.
Thank you. Mayor, I think you touched on most of the questions that I may have had. You talked about your interest in the board, your experience, your stellar experience. You're overqualified for this, but needed. You even talked about some of the challenges, the little bumps along the road. But I do have a question for you. Recently, the leadership, who I love, was with Dr. Steed this past Saturday at the Men's Health Fair at Cuyahoga Community College. Was a huge success. 20 years in the making with that activity. So looking forward to year 21 on that. Recently, the leadership made an announcement that the green space originally planned as part of the hospital's transformation project is being significantly reduced. The hospital included this body in the planning efforts of the original transformation project, especially because the hospital was looking for us to fund it in part. This most recent announcement seemed to exclude all of the original players, including the community. How would you recommend the hospital include this body and the community when making these major changes?
Well, I have a lot to learn, and I'm not familiar with this particular issue that you've just shared, so I would want to learn more about it. But one of my big questions that I need to get a grasp on early on is the governance structure of the public versus sort of the nonprofit piece of Metro Health's behavior. The public funding gives, I think, a significant stake in the performance and outcome of Metro Health. However, more of their funding is more in the nonprofit revenue-based delivery. So what I'm not clear on, and I'm hoping that perhaps you and others can help me understand, is what is the governmental charter? And is this for example, is that space publicly owned? And if it is, then public space has to go through a due process of how it's used. It's the nature of public space. And that can be challenging, it can be contentious, we can have differences of opinions, but how we use our really precious land, publicly owned land, is a big part of, I think, the growth and viability of our region. So if it's public owned land, then the process needs to be robust. If it's not, but it has public ramifications and green space is important, then there's an opportunity to create partnerships where that similar green space might be close by and developed. That's maybe a different state of use now that could be a higher, better use. I'm sure there's a good reason in some people's minds as to why the green space gets diminished. I know for a fact that the physical infrastructure of healthcare today requires much more space. Everything is bigger because of the nature of the equipment and the technology that's brought to bear. An operating room in a different time and place was 600 square feet. Now it's 1,500, 2,000 square feet. Hallways might have been 10 feet wide. Now they have to be 15 or 20 feet wide just to get equipment up and down hallways. I mean, everything is supersized, and there's a reason for it. So understanding what's pressurizing that, the change of the green space and its loss and its what it means to the quality of the campus has to be thoughtfully dealt. So I don't know if that addresses, the answer is I don't know enough to be able to provide a more detailed answer than that.
Yeah, I think we're all confident that you're going to bring some stability and some sound decision-making to this board, and more importantly, that you believe that it should be an inclusive decision. So we're looking forward to that. Councilwoman, did you have any further? Councilman Miller?
I just wanted to thank you, Madam Chair, for bringing up about the green space. I've also heard concerns expressed about that and concerns that it's felt that the new decision represented a going back on commitments that were made through public processes. And I think it needs to be that this isn't the final answer and that there needs to be further discussion on this subject. Thank you.
You're welcome.
So I'll make it a point to follow up on that when I'm on the board.
Absolutely.
Should you put me there?
Of course. Well, let's get to it. I'll make the motion to move this item to the full body of council for second reading approval under suspension of the rules. Is there a second?
Second.
It's been moved and seconded. All in favor?
Aye.
Please add Councilman Sweeney's, Gallagher's, Miller's, everyone's name to this legend.
Thank you.
Thank you, Mayor. Is there any miscellaneous business? Seeing none, this meeting is adjourned.